All right, good evening, everyone. We have on the line Dr. Vincent Taffuri, DC, and we have another special edition of the Dr. T podcast series. This uh, specific episode will address something near and dear to me personally, namely my back. About 2 weeks ago, approximately, while performing a deadlift, I felt an incredible pain in my lower back while coming down. I could feel my form had wavered just a little bit. And right after that, I basically could not even bend over. I basically had to stay there standing up. And thankfully, Dr. T was on the line. I was able to talk to him, even though it was later in the evening. And he was able to advise me to stabilize myself before I could get a medical professional to look at me. So that being said, Dr. T, if someone finds himself in this situation, what could they do immediately to fix it? And then what can they do to treat it once they have a professional diagnosis?
Well, that can be a mixed can of worms, but look, let's understand something. 8 out of 10 people are going to experience some form of back pain in their lifetime. And unfortunately, there's a high rate of recidivism, which basically means that you're going to get it back again, unless you just start to look at the true aspect of what the cause is. And the true aspect of what the cause is, because most of the time they say there's a high reality of what they call idiopathic onset, which means they don't know the reason. The chiropractic profession, and it's over 100 years of existence, have come down to realize that the biomechanical mechanism of the spine, the joints that make it up, and the spinal joints are basically comprised, they make up three. There's a right and left facet joint, which guide and glides the motion of the spine. And then there's an intervertebral disc joint, which basically works as a shock absorber. So you've heard of people, they sneeze and they blow their back out, or they twist the wrong way, they move too fast and they hurt their neck. And essentially what was going on is that this biomechanical misalignment, less than a dislocation, but not the normal articulation of the joint, we call it a subluxation, okay, that is out of its normal juxtaposition. The two bones are not lining up properly. And as a result of that, there's abnormal motion and sometimes fixation, which means it loses motion, or there could even be an excessive amount of movement where it becomes hypermobile. So the clinical diagnostic assessment has to be made by a trained professional. And being a chiropractic practitioner for over 40 years, I can tell you without a doubt that we have the tendency to basically assess and diagnose is really better than anybody else, including a lot of practitioners within the medical healing arts. And that's not to say that they're incompetent. It's just that their focal understanding of the biomechanical mechanism of the spine is just not the same as a chiropractic physician. And typically they're going to be saying, well, I don't really know what's going on. You sprained, which basically alludes itself to a ligament situation, or you strained a muscular situation. But the mechanism of altered joint misalignment has multiple effects, including the ligaments, the muscles, the nerve, the blood supply, and the bony structure, as well as the cartilage and the disc. So this biomechanical function is actually multiple components, and each one of those things have to be addressed appropriately. Once again, the profession that has focused mostly on that has been the chiropractic profession. And we could obviously make an appropriate assessment and diagnosis to help treat this biomechanical lesion before it becomes progressively worse, because it's not just the localized effect. What happens is those two bones can be out of their juxtaposition, creating havoc on multiple things, including nerve supply. If anybody has ever had pain that's come from their back into their leg, it's called sciatica. It's a miserable thing. And most of the time it's due because of this altered alignment of the vertebrae in the lower portion of the back that pinches the nerve and it goes down the leg. And it could go to the butt or to the knee, or all the way down the foot. We call stage 1, stage 2, and stage 3 sciatica, respectively. It could become more significant when there's a disc lesion or damage. So, based upon the level and the severity of the problem, once again, making the proper diagnostic assessment through a clinical assessment, orthopedic, neurological, chiropractic, assessment, or x-rays many of the time are necessary. And if the condition is more severe and significant, the use of an MRI to determine the extent of the soft tissue lesion. So these are the different things that the chiropractic practitioner will utilize typically to assess the problem associated with neck pain and back pain, and then guide you through the proper source of self-care. If you can't get to the doctor in time, which we did with Craig, the application of ice to the back, with a protective mechanism, keeping it on for 20 minutes, taking it off for 2 hours. If it's been more chronic, maybe then switching to heat, moist heat. So once again, you have to work one-on-one with a trained professional who knows what they're doing.
That said, to your point, when I finally did have a chiropractor take a look at me, he had said that I had numerous misalignments in my spine, specifically where the spinal cord ends and connects to the pelvis. So I think what you said is very valid, and I'm sure years of squatting, deadlifting, and this type of stuff has.
Sure.
Well, I've never been injured in my life before. I'm getting close to midlife, and I just got the bill for years of bad form for previous injuries that were maybe minor and I didn't treat, and then it showed up in the form of an S1 joint sprain, which, as you had mentioned, is a soft tissue issue.
Right. And all those things can be addressed and taken care of appropriately. And remember one thing, a biomechanical misalignment many of the time can be found. It's like going to the dentist and he looks in your mouth and he says, I think you have a cavity. And they take an x-ray and sure as heck, it's there. So what are you going to do? You're going to wait till that cavity creates pain, decay, and infection to the point where it's creating misery in your life? Or you're going to fix it beforehand. That's the preventative treatment, the prophylactic treatment. That's what we recommend for patients, okay, who have spinal misalignment. And believe it or not, from birth through seniors, all people will have subluxation in their spine at one time or another. And because of the direct correlation, not only with pain and discomfort, but abnormal communication of information in the central nervous system, meaning the brain and the spinal cord, communicating via the exit between the two bones in the spine out to the rest of the body, the peripheral nervous system, will alter that communication from brain cell to tissue cell, and then create other issues of health problems. It could be high blood pressure, metabolic issues, diabetic issues, cardiovascular problems, weakened immune system that could lead to other significant aspects of sickness and disease, making the body more susceptible to things that they never, could have basically fought off beforehand. So the chiropractic profession, being around and its inception in 1895, has done a world of good for people. And I believe that people are waking up to it and understanding that, look, medicine is an important factor, but the reality is that the prophylactic aspect of good health has to be a combined effort of diet, exercise, nutrition, sleep, stress management, and proper spinal hygiene amongst the things that can be done to keep people healthy and strong.
Well, very, very profound words, Doc. So that being said, I have to, it was prescribed that I see this chiropractor, get my adjustments, as well as acupuncture 2 times a week. Well, acupuncture once a week for, about 10 visits total. So that being said, I was told my last visit, it looked about the same in terms of inflammation of my joints. So if someone's in that position that I'm in, what could they do at home to help alleviate?
So here's the other thing. Aside from following your corrective care, remember, chiropractic is like orthodontia for the spine. In other words, if your teeth are out of alignment, you notice all of a sudden that you're not biting down properly, or you don't like the cosmetic look at it. Well, you between Invisalign and the traditional braces, over a period of 2 years, those teeth can be straightened out, and then you wear the retainer basically to bring the alignment back in position. So more than likely, your treatment from the acute phase, because you're feeling better, has gone now to the subacute phase, and we want to basically make sure it doesn't become chronic. So you're probably going to have to do more work with the doctor, implementing different modalities, different therapeutic, physiotherapeutic things, and adding different other treatments like PEMF, pulse electromagnetic field therapy, or acupuncture can address a lot of the other aspects that help the body heal itself. Another big component that's imperative is your diet, your nutrition. Smoking creates vasoconstriction. Okay, so when you smoke, you create a reduction of blood flow to the area, so it impedes healing. Eating foods that are high in complex carbohydrates, sugars, grains, pastas, breads, things of that nature, creates metabolic inflammation, a metabolic inflammation that can mess up your gut and create a source of inflammation. So once again, it's not just one thing, and diet has to be looked at as well. And quite frankly, then other things too. Look at the emotional levels of stress, especially now that people are going through in this situation of pandemic, of lost jobs and homes and financial stress and lack of social ability. People can't see their family, their loved ones. They can't go to a movie theater to see a movie. They can't go see a play. This has had a horrible effect on the ability for people to really optimize their level of health and function in many ways. But you're starting to get around many of these things by figuring out ways to stay healthy and strong and communicating with family and friends. And we have to just realize that you can't soothe some of these problems and make them go away by using and consuming too many things that are unhealthy for you, including drugs and alcohol and bad foods. So you got to look at all those different things. And not to plug my book, but that's why I wrote it. Simple Steps for Healthy Living: How to Grow, A Guide to Graceful Aging is a book that will tell you many of these different things that you can do to improve your health. It's just too numerous right now to go through it, but the information in that book that talks about the gut microbiome and the inflammation and gluten and how it works and what it does, and leaky gut syndrome and metabolic resistance and the effects that sugar has on your body, and on and on and on. So for $16.95, you can get a lot of help here to help yourself, and then seek out professional care in the area that you live. Whether you're, because Greg, where do you live? You live in North Carolina. So you couldn't see me, but I helped you through some of the things to do. You found the appropriate chiropractor to see, and now you're on a program of improving your health, not just merely eliminating your symptoms. And that's what we want to teach people. Spend the time, be proactive, do the things that need to be done. You can have a healthier, longer life. Absolutely.
Very well said. By the way, I did actually forget to mention that electro pulse therapy was included. Unfortunately, It's not a cool chair like you have. It's essentially a bunch of diodes that were stuck to my lower back. But nonetheless,
well, a lot of these things are still very beneficial. I'm sure the doctor knows what he or she is doing. Just follow their guidelines. And of course, once again, if you ever get into further trouble, obviously I'm always here for you. And, we do telemedicine visits as well for our patients. So that could be always reached out. You could always make appointments right online. We could do virtual, treatments for people as well. But, we like to do the hands-on stuff in the office. Myself and Dr. Nick, or a doctor of physical therapy, working hand in hand with me as a doctor of chiropractic. And we also have a group of other healthcare practitioners, including medical doctors, that will assist us when we need more aggressive forms of treatment. So that being said, look, this was fantastic. Thank you so much, Greg, for bringing me on board tonight. And, we're here to help people. So why don't you tell them how they can reach out to us and maybe even get our book?
Sure, absolutely. I'll put the link in the description for Amazon where you can purchase the book. And as for Dr. Taffuri's services, if you go to taffuriwellness, all one word, .com, which will likewise be a link in the bio as well as in the video itself, you can visit, give the office a call. What was your number again, Doc?
It's 201-773-0909.
Absolutely. And anyone who's listening, please feel free to call for a consultation, to see if the doc can help you figure out what's wrong with you before coming in. We, as the doc always says, we can't find you. You have to reach out to him. So
Thank you. All right. Fantastic. Thanks so much, Greg.
You're very welcome, Doc. You have a good rest of the evening.
Thank you so much. Have a good evening. Bye-bye.
Bye.